If you ever find yourself in an emergency situation like this, where someone appears to be unconscious, first check for danger. Make sure the casualty, any bystanders, and you are safe. Then check response. Gently shake her shoulders and ask her loudly, "Are you all right?" If she doesn't respond, shout for help.
Help!
Next, you need to open her airway. When someone's unconscious, the tongue can sometimes fall back and block the airway. To open the airway, place one hand on the forehead and tilt the head back. Using 2 fingertips of the other hand, lift the chin. You need to know if she's breathing normally. You do this by looking for chest movement, listening at the mouth for breath sounds, and feeling for breath on your cheek. Take no more than 10 seconds to do this. In the first few minutes after cardiac arrest, a victim may be barely breathing or taking infrequent, noisy gasps. Don't confuse this with normal breathing. If she's unconscious but is still breathing, you need to put her into the recovery position. This allows the tongue to fall forward, keeping the airway clear. It also reduces the risk of any vomit blocking the air passages. Kneel beside her, and if she's wearing glasses, remove them. Make sure her legs are straight. Place the arm nearest to you out at right angles to her body. Elbow bent with the palm of the hand uppermost. Bring the arm furthest from you across the chest. Hold the back of her hand against the cheek nearest to you. Then with your other hand, grasp the far leg just above the knee and pull it up, keeping the foot flat on the ground. Keeping the hand pressed to the cheek, pull on the thigh to roll her onto her side towards you. Adjust the upper leg so that both the hip and knee are bent at right angles to prevent her rolling onto her face. Tilt her head back to ensure that the airway stays open. Adjust the hand under the cheek, if necessary, to keep the head tilted. And check her breathing regularly. If you've not already done so, send someone to phone 999 or 112 for an ambulance. If you're on your own, you'll need to leave the casualty in the recovery position and do this yourself. The operator will connect you to the ambulance service and will ask you some questions such as your telephone number, the location of the incident, and what's happened. Remember to stay calm, listen carefully, and speak clearly. Answering these questions is important and won't delay the ambulance. Once you know help's on its way, stay with her until the ambulance arrives and recheck for signs of breathing at regular intervals.
Wel.